how I got to Castlebar. Yes, in those days there were very few county physicians, as I said. There was one appointed in Monaghan, Cavan, and there was already one in Limerick, and there was then there was one in Waterford and one in Donegal, and now there was one for the first time advertised in Castlebar. So I applied for it and was appointed. And I took up duty there on the 1st of January 1967. And it was a small hospital then, very well run by the matron, not so well run by the matron, the assistant matron, and the
can you remember her name?
The nurses. The assistant matron was Miss Gormley.
Miss Gormley, yeah.
And
who were the other doctors there at the time?
Then Miss Lehane arrived with me. There hadn't been an obstetrician until then. At that time, the GP, Dr. Moran, did the obstetrics in the hospital and ran it also. He did the medical patients as well.
Surgical?
And so he died then, I think, subsequently to that. His wife was a doctor too, Moran, Mrs. Moran.
Cell.
And
who was on the surgical side at that?
Pardon?
Who was on the surgical side at that?
Bresnahan.
Paddy Bresnahan.
Paddy Bresnahan, and
a legend.
Then there was a junior surgeon. He was only allowed 2 beds, and Mr. Bresnahan then had his own house, and he was called the surgical hospital. Even when I arrived, the patients would say, I was in the surgical once or twice before. Now the patients would arrive and the outpatients or to the clinic, and I'd start to take the history and they'd say, it's all right, Doc, you needn't go into that. I've just come for for an X-ray in Dublin. I said, in what part of Dublin would you like to go to? Phoenix Park is very healthy. They didn't appreciate the humour. So it took ages to redirect them. The outpatients I was given, no one had ever done outpatients in medicine before, and the outpatients I was given was in a prefab that consisted of one room that I had with a kitchen sink, an old kitchen sink, and a draining board. The draining board was the table to write on, and there were 2 couches with a raggedy old curtain in between. It didn't even come fully the length of the couches. The nurse had been a British Army nurse, and she ran it like they were all soldiers. And she'd come out and she'd bark at them when they were to come in, bark when they were to go that door out. And it wasn't comfortable or rewarding for any patient to attend. So Miss Lehane had a ward of her own and did her own outpatients, and she improved the standards, of course, of midwifery. She was dedicated and even had a little couch bed that she'd stay in and overnight if she was at the woman was expecting to deliver in the early hours of the morning. She'd stay on.
Yeah, I worked with her.
Yeah, she was very good.
Very good, yeah.
Then
you lived in Westport, did you?
Pardon?
Did you live in Westport or Castlebar?
When I arrived, the first place was in the Welcome Inn. The fellow from Lehane who built it, I said that we have a baby, had we 2 babies?
I think 3.
3 babies, and I'm looking for a house to buy or rent, but could you put us up? So he agreed. and he gave us 2 rooms for the family upstairs, and we lived there for 3 or 4 months. He was very kind, and we then rented a house with out in on the quay of Westport.
Nice
and
place.
That's when Sinead Cleaner was born.
Oh yes,
there.
there was 5 of us then.
There
when
were
I was
5
born,
then,
yeah.
yes. So we then moved into Castlebar itself.
How long did you stay in Castlebar?
Was there I was appointed in 66 and I left in 69, on December 69, you could say January 70. I got the job then in Galway as lecturer in medicine and consultant in medicine. And when I was in Castlebar, I started the rheumatology clinic without the permission of the department or without the knowledge of the department. And I ran it as a medical clinic and rheumatology inside the shelter of the title. And then when I came to Galway, I called it the rheumatology clinic. And I kept on the clinic in Castlebar then and commuted every Friday and held the clinic there in Castlebar, purely rheumatology. And I kept that on for 4 or 5 years until it work grew too hard. The teaching and the medical work in the regional got too hard that I used to let the registrar then go over and do the clinics on Friday, once a month in Castlebar. And then I noticed that there were 2 or 3 units empty in Mullen Park, and I suggested that if they would refurbish and reactivate one of the units there, it would take 40 beds off the overcrowded regional hospital. And I could also do my outpatients there, which would unload the weight of work in the regional outpatients. So they agreed to do this, and they did up a unit, and we opened that in 1975, and that became the rheumatology centre for Mayo, Galway, and approaching, going on to County Clare, Roscommon, and County Clare.
Donegal?
Donegal, yes. And
That's still there?
we trained then the registrars in rheumatology and medicine. We never got senior registrar grading then. That was only coming in, although in Dublin they were beginning to call their junior doctors senior registrars, but the grade didn't exist. We were just copying England slowly. And eventually then they became senior registrars. So two of my junior doctors became consultants in rheumatology, one in Limerick and one in Canada. I don't know what, maybe more did. But
so you stayed in Galway until what year? When did you retire?
I retired
from the public service
on June 1992.
1992. But you continued to work privately?
I continued to work privately. On the 6th of June 1992, I got a letter from the CEO. We note that you will be 65 on the 7th of June. Your services will no longer be required. That was it.
No, thank you very much.
No,
thank you very much. So you had a long career in medicine.
and that was it.